Welcome to the Alivio Medical Center podcast. My name is Dr. Anthony Hillebrand. I'm the physical therapist here. So today we will talk about balance. So I have a lot of patients who come in and we're seeing them for a multitude of issues, sometimes shoulder, back, neck, ankle, knee, whatever it may be. But a lot of them report, oh, my balance is horrible. And they question why, if they're here for their back, why am I having them work on their balance? There's a couple of reasons we have you work on your balance. First one is if your balance is bad, you're more likely to fall. You fall and you're going to hurt something or have a higher chance of hurting something. So we have you work on your balance. The next reason is it works on core strength. So if your core is stronger, then you're more likely to have control of your back, so you're less likely to have pain. So those are the two big reasons. Now, I'll have people work on, marching, some sidestepping, walking backwards, and they're like, why do I have to work on that? Because it's making you use muscles that you either don't use or muscles that you use in a limited range, in a different range, and it makes them more dynamically stable. So you're able to control yourself better. The better control you have, the less strain you're putting on other parts of your body, which is typically your back. But I'll have people complain, why am I walking? When they're doing the marching or the sidestepping or the walking backwards. And I explain this to them. You need to do this in order to, build up strength in these muscle groups. And they're struggling doing it, walking, maybe 80 to 100 feet, marching or sideways or backwards a couple of times should not be enough to wear you out. If it is, then you really should be doing it more often to build up that strength and that endurance. So with patients who, get through this portion, then we start tackling other dynamic activities. Whether it's using a BOSU, which is that kind of half exercise ball thing that I'll have people on, a foam pad, changing their base of support, so moving their feet in or out, or staggering them so they're heel toe. And we do this in order to challenge that system, to have you figure out how to use those muscles more correctly. And it does typically work really, really well once people do it. I do have a few patients who will fight me tooth and nail on some of this stuff, and well, my other therapist didn't do that, or the massage therapist didn't have me do that, or the chiropractor didn't have me do that. That doesn't matter, because at the end of the day, we're taking you as you currently sit here ahead of us. What are your impairments? What is contributing to your issues? If, the last time you saw the therapist was, 20 years ago, a lot of things have changed in therapy since then. So, when you come here, what I try to do is use the most up-to-date information, the up-to-date techniques, and what has worked. Now, if somebody isn't responding accordingly, then of course you change. I have run into patients who have seen other therapists and other providers who, I went there 50 times and I'm no different. Or I've had a few patients who have seen chiropractors for, 10 years, 2 to 4 times per month for 10 years, and they're coming to see me for back pain. And they're like, well, I see the chiropractor for this, and I feel better after I see him. And then it lasts a little bit, but then it comes back. And that's why they keep going. My goal is to truly get you better so that you don't have to keep coming back. I mean, if you want to come visit, fine, but my goal is really to get you better. So, but that's, a little bit back and forth between us on what that's going to take. So, with balance issues, I'm going to put you in unstable situations you're not used to, because I want to work on your balance. We may spend an entire session doing that. Now we're going to do it safety, focused, where I'm not going to put you on top of a BOSU and have you, balance on one foot, like the Karate Kid or anything. But we're going to work on those things. We're going to work on step-ups on the unstable surface, functional activities in these areas so that you can get better. And it'll take 2-3 weeks before you start really noticing a difference. But I have patients surprised where, they could kind of do a squat, just on the ground, from the chair up. And then I have them doing squats on BOSUs in a couple of weeks. And they're always surprised, about how much progress they made and how much better they feel. That's really what I try to do with patients, is put them in situations where they're going to be challenged, but at the end they're going to succeed. And they're going to be surprised about how far they make it. So that is my philosophy on why we work on balance. There's multiple ways to address balance, for all sorts of levels. I mean, my oldest patient ever was 108, and my youngest patient ever was 2 months. 108-year-old was in the nursing home. We were just working on general rehab, trying to get them stronger and more functional so they could get up, walk to the bathroom, things like that. And then my 2-month-old that I worked on was for torticollis, which is a shortening so that they end up getting their head stuck towards one side. It's fairly easy to fix once you teach the parents on some changes to make at home, how to interact with the kid a little differently, and some gentle stretching. But little kids don't tend to tolerate stretching a whole lot. So it's more functional and play activities that you focus on. So across that age spectrum that I've worked with, I can tweak things quite a bit depending on the person, as long as the person's willing to participate, because that's the biggest thing. It doesn't matter how good your therapist is or doctor is or whoever it may be. If you don't do your part, it's tough to get better. Like, you can have a knee replacement. Orthopedic surgeon does a terrific job replacing the knee, but you don't do your rehab, and then all of a sudden you're back and that knee is stuck, where you should have range of motion from 0 degrees to at least 120, and you're stuck from about 20 degrees to maybe 90 degrees because you didn't want to move, you didn't want to do anything to get yourself better, which at the end of the day, that's your responsibility as a patient, is to do your part. Plus, these days you have to be your own advocate when it comes to healthcare decisions, and you have to be an active participant in your care. Otherwise, you're going to find yourself in the situation where somebody chooses the quote-unquote appropriate medical treatment, and it was not the most appropriate medical treatment because you didn't have your input. So, at the end of the day, when it comes to whatever modality you need to be treated with, ask questions, but keep an open mind at the end of the day. Most therapists out there, because you can never say always in every, most therapists out there do a very good job and do have your best interest in heart. You just have to have that conversation. One of the things I tell my patients is, you're completely able to come and give me any feedback, good, bad, or otherwise. If we did something great, I want to know that. If we did something that was made you more sore, caused some pain, I want to know that as well. There may be a legitimate reason why you feel the way you do, and we'll talk through that. Or it might be, okay, well, that may have not worked out the best. Let's try a different approach, because everybody is different. Like, I may know for back pain, if you do X, Y, and Z, you have a 90% chance to get better. There's that 10% chance. So I leave myself flexible enough to be able to tackle a different path with that 10%. And I ask patients to do the same. Be open to a different way of doing things. Because yes, the way I operate is different than a lot of therapists I've worked with. What I'm comfortable with, what I tend to avoid, may or may not be the same as the next therapist out there, because my background, both from before I came a therapist and going through PT school and what I've done since then is a lot different than a lot of people I know. I didn't follow a traditional path for a lot of this stuff. And how I believe patients should be treated is different. Because I kind of see myself with every patient that I end up treating is how would I want this treated? How would I like this approached? For my own sake. Sometimes that lines up, sometimes that doesn't, but at least, it's a good place to start is if you were treating yourself, how would you want yourself to be treated? But leaving yourself open for personal preferences and religious and cultural preferences. So that's my 2 cents on balance. We kind of got off on a little tangent there, but it is what it is. Make sure to subscribe below for additional videos, and then check us out on Facebook at Alivio PT or on our website at aliviophysicaltherapy.com. Thank you very much.